Hello everyone, good afternoon and welcome to Face the Future. That's the title that they gave us, and obviously it's a pretty inspiring title because it's to do with the future of our faces, how we choose to age, what we decide to do, what we decide not to do, and I think we're at a time now where that decision, answering that decision, or even just choosing to ignore all of it, has never been more complex. It's also very scrutinized, and I feel like we're at a very interesting time because we have real choices and we can do as little or as much as we want to do. My name is Kathleen Baird-Murray. I'm a journalist of 30 years standing. I have written about beauty for British Vogue, for How to Spend It, for Tatler. I've written books about it. And I've really watched the industry evolve from, I remember seeing the very first time I saw somebody do Botox in a clinic in New York a very long time ago, to where we're at now with this sometimes quite bedazzling, bewildering array of treatments, procedures, and philosophies about aging. And I'm joined today, I'm really excited. The wonderful thing about doing these things is you get to meet new people, you get to research, you get to ask them lots of questions. And we've had lots of nice chats before today in preparation. And I've got three extraordinary experts on stage who all approach facial aging from very different perspectives. So I'd like to introduce you to Mr. Marc PACIFICO. He is a plastic surgeon and former president of BAAPS, who's at the forefront of contemporary surgical techniques. I have Dr. Jonquille, CHANTREY, who has 20 years in aesthetics. She's a global key opinion leader committed to patient education and empowerment. And she's also the host of Ageless, which is a medical podcast on science-led empowerment for modern aging, health and beauty. I've listened to it, it's very good. You will find it on, all the usual podcast places, that's right. And on the far left, I have Michaella Boulder, who is a facialist with something like 18 years of experience. She's seen, held, touched thousands of faces in the course of her career. And she is launching her online facial massage platform, which I know we're all going to find really interesting, in February. Now, we don't have a lot of time, and we've got lots to cover, so I'm going to dive straight in. Try not to throw all my cards on the floor first. Okay, so we're going to start by looking at just how the landscape has changed. And Marc, I'd like to start with you. When we were talking, you mentioned that the theme Face the Future makes you think about how surgical techniques have evolved over the years. Can you explain what's different about contemporary approaches to facelifts compared to, say, 10 years ago, when I do remember meeting people in New York and there was a horrible expression for it, wasn't it? It was the wind tunnel facelift. How have things changed since then?
It's a really good question, and one that a lot of people are interested in, because if I look at the beginning of my practice 15 plus years ago, I'm doing things totally differently now. And I think there have been two paradigm shifts. In the past, people used to think about lower facelifts, and that was really just making sure we concentrated on the jaws and the jowling, and that was what most people came in aware of. But what we saw is not only those sort of wind tunnel looks, but also that fourth dimension. How's that person going to age, and how's that facelift going to behave over time? And I saw it in my own patients 7, 8, 9 years later, when there was a discrepancy between how they were aging down here compared with here. So a lot of people will be familiar with the extended deep plane facelift as a term that's become very well known, and that's really referring to the fact we lift the whole face, or the mid face as well as the lower face now, in one unit, as well as the neck over here. And it's much more harmonious, it ages well, and it looks very natural. And then the second big difference, the big paradigm shift, has really been much more of a focus on the neck and making sure that we are harmonizing the neck with the face. And that wasn't done, I don't think it was done very well much of the time in the past.
Thank you. So it's really more about treating the face as a unit, rather than isolated areas, which sounds obvious, but I guess it wasn't that obvious to do. Jonquille, from your perspective, in both non-surgical and surgical aesthetics, What are you seeing in terms of how patients are approaching their faces in 2026?
I think there's two ways of me personally looking at it with the work that I do. The kind of patients that I see, they're very considered, they're very discerning. Many of them I've been looking after for over 18 years now, so I've seen them throughout different decades. So their priorities have always been, natural, sophisticated outcomes that are evidence-led. So they're not as trend-sensitive. However, the other part of my career is I do a lot of trend forecasting work with big global think tanks and a lot of research and consumer insights. And what we're seeing is this sense of urgency throughout the decades, not so much with male patients, but certainly with female patients. They're feeling this sense of urgency to start to treat, perhaps have surgery, and they're not always entirely sure why. So again, I think it's very much about recommending evidence, a real calm approach, understanding what it is that's driving you, and being driven not by celebrity glorification and hot trends and what's new and what's next, but what's proven and what's safe.
So perhaps a bit of, maybe you said female is more urgent, driven by urgency.
Yes.
Is that necessarily a bit more emotional, perhaps, do you think, or?
I think it often is driven by emotions, and everybody has their own reasoning. It could be that they've had some medical illness, a big life event has happened recently, they might be going through a new lease of life, other opportunities, all sorts of different emotional drivers can be happening. And I think it's really crucial in those moments that people don't do a knee-jerk reaction. And I'm sure Marc would agree with this. I'm sure you see it in your practice all the time. Is now the time I suddenly need a facelift because of some emotional event that's happened now? So I always recommend to my patients, let's take a calm, measured, strategic approach.
We're going to come back to that later. But I want to ask you, Michaella, because you are seeing, obviously people come to you for facials predominantly, and you've had so many different faces under your magic hands. What patterns are you seeing in how people are wanting to treat how they age now compared with when you started 18 years ago?
So obviously it's a photographic generation, so we're taking so many photographs. We just had the 2016 new trend that everyone had to post pictures of what they look like in 2016 compared to now. And it's such a big shock. We were speaking the other day, and even just 2 years ago when I started to create the bolder movement, was I doing lots of filming, and then I'm now seeing those videos 2 years on thinking, sorry, what's happened to my face? And it's the change in the shape of our face with age, hormonal changes, health issues or lifestyle changes, collagen degradation. Just the shape of our face naturally changes as we age. And I'm saying age with 6 months, a year, 2 years. So when we do a throwback of something that we looked at many years ago, and although we still think we look the same, we look completely different. And the fear factor sets in. You then look and think, God, look at my lovely cheeks, or look at the shape of my face, or maybe I want my hair like that again. And then you start to question every element of yourself, or you go back to a year that you loved, and then you start focusing on that picture that you really liked. I'm going to start wearing that outfit again because that made me feel really good. We are always looking, naturally, it's human nature to have a bit of a dopamine hit. And then when you see something that is a change of a past image, it can be quite confusing for yourself, and then you start to feel a little bit low, and then you start to look for changes. And I think, like you were saying, the change is quick. We want something now, and I think it's just about being realistic and honest, and then working out how you're feeling in yourself and what changes you're looking for, but just actually truly coming back to yourself and acceptance and maybe a bit of surrender.
Thank you, because fear, which you touched on, is probably a bigger point than we give it credit for, in a way. I mean, Michaella, you mentioned fear earlier. Is this something that people come to you for at their most vulnerable? Is there something to do? What is the thing about fear? What is? I want to ask Marc and Jonquille as well the same question. How much of getting a change or looking for change in your face is driven by fear?
I'd say pretty much the majority of it from about the age of 30. So you get to 30, we all feel a little bit different in ourselves naturally. Life changes, you start thinking, I haven't ticked as many boxes in my life as I thought I may have done by the time I'm 30. So then it's also the aging process sets in and we start to see fine lines. You wake up on your 30th birthday and see crow's feet that you didn't have the night before. So I think the fear starts around then, and we all feel it at some time in our lives. And then that fear is the driver of making change. So then when the client visits me, I'm generally the first person, so a facialist, they'll come to a facialist and say, I'm really unhappy with my skin, I'm starting to feel a little bit more dehydrated, these fine lines, where have these fine lines come from? I really want to fix them. And then the journey will begin. So it's about just having a moment. I feel like my job is, I'm not just a facialist. We sit down and we have a chat, it's a consult, it's just about getting to know each other, but seeing the points that are uncomfortable and then planning a journey, which would then lead from me to these guys, and then allowing that space between their journey each time.
Jonquille, how do you help patients navigate that fear?
Again, every day within my clinic, on one-to-one level. On a broader level, actually, I want to understand different cohorts of people and how they're behaving. So we actually published in the Aesthetic Surgery Journal a really big piece of research where we interviewed 14,500 consumers from 18 different countries. And we also interviewed 1,300 physicians to understand their perspectives of aging, what was important for different aspects of facial aesthetics and beauty. And a really common theme was this fear of aging. And this is throughout many different markets all around the world, including many different ages. And so I translate that work to the person that's also in front of me. How is that informing my work? How is my research informing my work? And I would say that combining both, I've come to realize that I think that there's two leading themes. The first one is uncertainty that drives fear. Often it's a feeling of lack of control. There's a lot of change that may be happening within our own personal lives and within the world around us. And as we start to see those changes within the mirror, it's how can we take a better sense of control over our own aging? And I believe that's a really key part to empowerment, if that is important to your self-image. So when it comes to uncertainty, education is everything. And so that's actually a huge reason why I started my Ageless podcast, was because how can we create more certainty? It's by empowering ourselves with correct information. I think the second part as well is comparison. And now, not only are we comparing ourselves in person, but of course it's that endless, always on social media comparison. So I think those two are big driving factors. So I try to talk to my patients one-to-one, and also in my clinic I have a wellness studio where we have a safe space where we sit in circle. We incorporate many of these beautiful practices that you're seeing here today, and we encourage honest conversation that helps to minimize shame and understand our own self-image.
Thank you. Marc, what about you? How do you, if someone comes to you and they're a bit fearful about how they're going to age or what they think is their future, how do you navigate that with them? How do you help get them through that part?
Well, just to echo what's been said, it's never an emergency. There's no call for an emergency facelift. So it's really understanding the why. Why is that person here? And it's often to do with loss of, or increasing sense of loss of identity, feelings of invisibility. And if you imagine, not nice to imagine, but an elderly couple in their late 80s with a hat on and a scarf on, you can only see their faces, men and women end up looking quite similar as we tend to lose our individual identity. And therefore, I think the tenets of any facial rejuvenation really need to ensure that person still looks like themselves, and it goes without saying, they shouldn't look like they've had anything done. And I think if you can, and certainly I can, reassure and demonstrate that those results and those targets are achievable, that really helps start that trust and confidence and relationship with the patient.
Thank you, Marc. Jonquille, you've mentioned this already today about how it's so important to give this direct-to-consumer education. How are you managing to do that with your podcast, Ageless?
Thank you. Always looking at the science first, so scrutinizing the evidence. And I think the problem that we face is with social media, and now media at large, is that content isn't the same as proof. Content isn't the same as evidence. But social media algorithms reward speed, pace, and they also feed into FOMO and that fear of missing out. So if you're not involving yourself or hooking yourself onto the next trend, there is this fear, am I going to age quicker? And again, as part of our research, we found that millennials have a real fear that they're aging faster, and then Gen Zs are even more fearful that they're aging quicker than millennials. So through Ageless, through the podcast, I try to create a more online space that we do in the studio. So a safe, calm conversation where we refer to the science, but we make it relatable so that it's actually in a lived way and how it's relevant to people. So I think combining that is crucial. And I think festivals like this is really important, where experts can speak up and we can find our voices again against these tsunamis of social media where there's just so much noise out there.
It's very true. Marc, you mentioned earlier when we were talking that you also see lots of cultural differences, that UK patients feel they have to justify wanting procedures, whereas in Australia or in the US, it's just accepted. Do you think that better education would help deal with some of the shame, the judgment, through making certain choices for your face?
I certainly hope so. It was interesting. I had an Argentinian plastic surgeon join me for a few weeks in my clinic recently, and the comment she made at the end of a day's consulting was, what is it with everyone you're seeing? Why do they have to justify why they're coming in here? And I think it is quite a British...
English, isn't
it's
it?
so English, isn't it? It's such a British problem that we feel embarrassment and guilt, and in most other countries in the world, people feel empowered and don't feel they have that element of shame. I suspect maybe the younger generations will come through without quite such baggage, but it is something that forms part of a consultation to try and tell people it's okay, you can be honest, and there's no judgment here. Absolutely not.
And presumably a degree of long-term planning helps with that, if people can see, if they can map something out before, if you face the future. Would that help at all?
I certainly think having a clear idea of maybe if there are things you would or wouldn't consider doing, and having a long-term plan with both your aesthetic physician, incorporating a surgeon, and any other experts is really important, because otherwise the danger is you go too far down some rabbit holes and some paths that aren't ultimately going to benefit you, and certainly won't necessarily benefit you over time and with the aging process.
Marc, you told me that you've got some patients who come to you many or perhaps several years before they're ready to have any treatment, just to find out what you think they should be thinking ahead for. Is that, how common is that?
It's not so common, but it's becoming increasingly common. I'll have someone come to me and say, look, it's not the right time for me now, but maybe in 5 years, maybe in 10 years, I'll be coming to see you and I'd like to talk about a facelift. What should or shouldn't I consider doing treatment-wise between now and then? And I certainly think there are some things that, if not done properly, particularly, can really cause challenges surgically. So I do have some honest conversations about what I would avoid and what I would recommend in the meantime.
Are there any things you can tell us about that people should avoid or should plan around, perhaps?
Okay. I have a very, very big problem with this concept of biostimulators. It is effectively forming scar tissue. So if the injections of biostimulators are not done in the right position in the face, i.e. on the bone, they can cause a huge amount of problems surgically. They cause a lot of scarring in different tissue planes. The other treatment surgically that causes potentially a lot of problem is radiofrequency microneedling, because that cooks the deep tissues and can cause scarring that causes tissues that should be able to separate surgically to glue together. It doesn't happen in everyone, but I just think if someone is going to have surgery as their goal at some point, careful consideration needs to be given about these sorts of treatments, who's doing them, how frequently they're done, and what the gap between those treatments and then subsequent surgery will be.
So plan ahead, basically.
Plan ahead.
And see someone good. Okay. Jonquille, as someone who works with fillers, which you do, and you're a key opinion leader globally for Allergan, what's your take on the current panic over filler migration?
I think that it's completely understandable within the consumer realm. I think it was a disaster waiting to happen because we are operating in a completely unregulated market. So it was not in safe hands. It continues to not be in safe hands. And the problem with that is it's the wrong product choice. It can be a cheaper product choice. And as Marc was saying, it's all around the technique. So it has to be in the correct level within the tissues. You have to be considering all the different areas anatomically that you need to be treating. And we've published extensively on safety, efficacy, and long-term results, actually, within using hyaluronic acid. I personally use that because it's reversible, and I feel it's safer in my hands. I don't actually use very much biostimulators at all. So I do think it was a disaster waiting to happen. And I think there's going to be a rise, perhaps towards the latter part of this year, where people will then start to realize that maybe they've stopped doing it because of all the misinformation that's been happening as well, concurrently, and they'll see that they are starting to age a little bit quicker because they perhaps haven't been keeping up with their HA over the last 2 years. And I think there'll be a rise, hopefully, of those who are creating natural, sophisticated outcomes that are safe and in the right three-dimensional form. You know, natural should never be a trend. Natural was such a big buzzword of 2025. And I felt really strongly about that. Why should it be a buzzword? Why is it so on trend to be wanting to achieve a natural look? That's how it should have always been.
In an ideal world, yes.
Sure.
Thank you. Michaella, you have a completely different approach. Non-invasive facial massage. I'm a big fan of facials. I love a non-invasive facial massage. Can you tell me a bit about your philosophy, but also your new platform, because that's really very interesting in relation to that.
Yeah, so I've been massaging faces for 18 years now, and I think it's always been more than just facial massage, because a bit like the feet, reflexology, pressure points, acupressure points on the face and the head and the neck. And it's all a very encompassing moment that the client feels so vulnerable when all of those points are being manipulated, moved, massaged, and it just calms the nervous system, it soothes the body. So when you just have a facial, you come out feeling completely renewed head to toe, because we've worked all of those areas, relieved tension, lymphatic drainage, stimulation, and no, I always say to my clients, look, we're not changing the world. We're not changing lives with facial massage. But what we are doing is we're making you feel really good. And that's
You're changing our world.
Yeah, I hope so. I love my job so much. It's such a personal thing. And every client that comes to me, they don't just come for a facial. They come for a little bit of facial therapy, they say. So they're laying on the bed and they're warm and they are made to feel important. We're talking about their concerns. I'm talking about how they feel. I'm trying to give them back a little bit of confidence. There's so much noise around what we should be doing and how we should be anti-aging. I'm pro-aging. It's such a gift to age. So let's just have some resources in place, maintenance and prevention, and then start a journey together, which is where the Bolder movement came from for me. I have wanted to teach people facial massage forever. I always wanted to be in people's bathrooms, and not through skincare, because there's so much that's available on the market, which is incredible. Why would I compete with them? So rather than competing, I just wanted to give what I do to everyone and re-stimulate their facial routines at home, turn their routines into a ritual, and it's a moment for you, but you're so much more empowered because you're educated and you're helping to improve the efficacy of your products and your skincare, but you feel a bit like an expert in your own home. And that was what I really wanted to do, bring a little bit of community, bring people together, have a space that everyone can communicate, learn, be educated, and discuss. But that's all the result of a confidence for me.
So we will have no excuses, finally, to master the boulder technique and to be having you in our bathrooms, metaphorically speaking. Brilliant. Marc, I know that one question that people always want to know the answer to, and obviously it's different to each individual, to each person, but when is the right time? If you're thinking about having a facelift, what age are most of your facelift patients, would you say?
So I think the typical age range is sort of perimenopause to early 60s. So in your 50s is definitely the biggest demographic. Some people are having some surgery earlier than that, and I think there are bespoke occasions when that's appropriate. And I've done some facelifts up until people's 80s, but they are few and far between. So mainly 50s to early 60s.
Thank you. I'm 57, so I'm bang on schedule. But Michaella, you made an interesting point in your notes that some clients of yours make the mistake of having surgery too early. Is that a thing? Can you elaborate on that?
Yeah, so I have a bundle of clients that tend to come in around 40, and they say to me, yeah, my lower face is, I'm going to go for a facelift, my lower face is going. It's almost like it's the first option. And like we've said, with the fear and the panic, because it's the first initial sign of we are getting a little bit older, when you look in the mirror and all of a sudden you do the usual, I used to look like this and now I look like this. But that's a reality. Isn't that just a gift that we've got to this point, that we can see a change and embracing the change, but making it the best change that you can? That's what I'm all about. And facial massage, it's not going to give you an immediate facelift, but it is going to help to stimulate and tone and work on the muscle. But yeah, I think that when they come in and they say, I think I'm going to head in for a facelift at 40, it's just take a seat. What's happened? Why are we here and saying this? What has happened in your life? And then it starts to flow. And then within the hour, hopefully they've left and they said, whew, saving some money.
Well, you actually said to me that you suggest to your patients who are saying, yes, I want a facelift, that they go off and have a think for a year and literally take a year before they commit.
Yes. So having some space between your first initial thoughts and then coming away, a year is such a big time. We change so much. Like I said earlier, 2 years changing in my face was shocking, but it's not really that bad. But having a little bit of space between something that you think you want to do and having consultations, and I always say, go and visit some plastic surgeons, go and visit some people that you trust, go and visit some doctors, sit down with them, have that consultation, have 2 or 3 consultations, invest in that moment, take what you want from that meeting and come away and then have some space. So much can happen, and there's so much there's so much in surgery. It's not just, it almost seems like the new trend, doesn't it? Yeah, well, when I hit 40, I'm going to have a facelift. You know, there's so much in that space that is just not very mindful. It's that dopamine hit, that quick fix. I'm going to have a facelift at 40, I'm going to look great. Well, what about, when we get to 50 and 60 and you've had that decline again in collagen and we do hit menopause and we don't know where we're going to go and what our faces are going to look like, how we're going to feel. So having a space between a decision or a thought process and then doing treatments, almost throw the kitchen sink holistically at your face, start to work on your nervous system, start to work on who you are, where you're at, what really is going on in your life. And then in a year's time, if you sit down and look at yourself in the mirror and say, I'm still ready to invest, I can afford it, that is what I want to do. You've allowed yourself to be really clear and concise on that big decision.
Thank you. Jonquille, I know that you are a big proponent of being proactive rather than reactive. What does that look like in practice? What sort of preventative maintenance would you suggest to patients looking to change the way they are aging?
So within my clinic, we have a very comprehensive offering. As I said, we have the studio where we talk and support in terms of nervous system, because I think that's where it begins, and mental health. We work with skin extensively. So I do a lot of work with SkinCeuticals, with L'Oreal, with ZO, a lot of the research behind that. And so we have a very strategic skincare protocol for each and every patient. And then we assess their skin quality, their tissue quality, if it's laxity, if it's acne, if it's inflammation, if it's rosacea, what's happening hormonally with the patient. And then we have to have a very realistic time frame as well. What are their goals? Why are those goals there? And I think there's economic things to consider as well, because we can utilize all of these different things, but we have to also correlate that with a patient's own budget and own priorities as well. And, it's been a very beautiful journey. I have patients who started with me when they were 30, 32, and they're now 50.
That's incredible.
Yeah. And they started in their 40s and they're now 60. And I've got to tell you, my patients that are turning 60, they are completely redefining what aging is. It is extraordinary from inside out, their confidence, their relationship with their self-image, everything about how they address life is just extraordinary. And it's been a real privilege to watch that.
That's lovely. Thank you. Marc, you have a wonderful phrase, which is a good neck forgives an average face. Can you explain what you mean by that?
This is a surgical...
average face?
Yeah, no, that's what this is a surgical reference.
What is that?
And what it means, really, is that a surgeon or a facelift that's done that ignores the neck really doesn't give the best results. If a neck is not attended to, which depending on the person needs more or less surgery, it won't realize what it otherwise would. So if I reverse that, if I get a really nice neck on someone, what happens in the face still matters, but actually the neck is where really the result comes from, because a good neck produces secondarily a good facelift.
Now we know. Thank you. Jonquille, you're very committed to mental health in this context, and I know that it's something you explore on your podcast, Ageless. Has the mental health component of aesthetics changed over your 20 years of practice? One would hope.
I think it's more crucial than ever. It's always been important, and I think that working within beauty, aesthetics, plastic surgery, whatever, it's now becoming more relevant and more of a conversation. But at the start of my career, I'd be on a podium, I'd give a talk on mental health or whatever, and people weren't terribly interested within the industry at all. No. And we then published on some psychological aspects of drivers and motivations back in 2019 around positive aging. We first described positive aging because before that, it was very much, people must be wanting to all look younger and more beautiful, but actually we know that that's not necessarily the case. So I think with, as I said before, uncertainty, comparison, etc., it's now more important than ever. And there were a couple of episodes recently, actually. I interviewed an actress, and we discussed this term of aesthetic labour. And I think it's relevant to all of us, where we feel, because we're always on to a certain extent, I think it's the modern luxury to not have to be. Are we going to be photographed in any instance? Do we have to, post our lives in whatever way? And there's a degree of labour to that, and scrutiny, etc. And I think it can be relevant to many of us. And then there was another episode this week where it was with my meditation teacher from the studio, And we actually broke down what does wellness mean today beyond the performative, beyond the expectations of we have to be constantly optimizing ourselves. How do we return back to self-trust? So I think it's a huge subject, and I think it's the most important subject in the conversation.
Thank you. And continuing with this theme of mental health, Marc, you described yourself as being sometimes like a psychologist who works with surgery rather than talking therapy. How do you assess whether someone is psychologically ready for surgery?
So on two fronts, I think very much the consultation process is crucial, and I'd rather, in fact, the more I get on in my career, the longer I spend with patients before surgery, because understanding why, just like we've been hearing about, understanding what the goals are and why now are absolutely crucial. And I actually have, for the last 6-9 months, incorporated a colleague, a psychotherapist, with every one of my patients who, between their first and second consultation with me, will have a consultation with a psychotherapist as well. And that's been incredibly beneficial. It's made people reflect differently. It's made people think differently. And actually, it's provided me with some aspects and some answers that I wouldn't have gleaned just through the surgical or medical side of the consultation.
You mentioned something fascinating to me about sometimes husbands will be unsupportive. Can you explain what you were talking about there?
Yeah, I can say this being a man, and I kind of have over many years had so many comments from my patients about the disappointment with their husbands or partners. Why isn't he more supportive? Why isn't he there for me? And I distilled it into 3 different things, and this is really proven reliable. The first one is they're worried that something's going to happen to you. You're having surgery you don't need, and they're worried that you could come to harm. The second is that you're going to look weird, and that's a real worry for a lot of men. But the nuanced one is the third one. The third one, and I'm serious when I say this, and most women are quite surprised when I say this, they're worried about what their friends and mates will think of them because you look weird. And that's a very nuanced thing. And when I've had couples in my consultation, and we've talked about that, I've had my patient look round at her husband and said, "Are you really?" And the husband's kind of going, "Yeah, actually, he's right." So it's so important to reassure not only on the assumption we're talking about a female patient, but also her partner or husband, that actually the outcome of surgery is safer than ever. It's not risk-free. You should still look like yourself, and no one else should be able to tell you've had anything done, is absolutely important. And I think it's so much more productive when that patient's husband or partner joins them for the consultation. I think that just smooths out so many of those fears and worries, and then brings them on board to be really supportive.
Thank you. Any husbands here, take note. Jonquille, you mentioned homogeneity. I can never say this word. Homogeneity. We were talking. Okay, the Instagram face, basically. Everybody looking the same. How important is multiculturalism to you? How do we preserve that individuality when there's so much pressure to look a certain way?
I think it's absolutely crucial to respect not just the anatomy that's in front of us as practitioners, but just all the beautiful features that somebody can present with, all the attractiveness features, and the things that make them them. It's sometimes a term that's overused, but the proportions of the face, understanding all the different genetics. So I'll often ask, not just the grandparents of ethnicity of my patients, but the great-grandparents, and just understanding how the different genetics interplay in terms of their skin behavior, their pigmentation, their scarring, but also it helps me to understand how they're going to age prospectively as well. And we can then help to guide them in terms of lifestyle factors. I mean, for me personally, from my mother's side, I'm British French, and then my father's side is native Hawaiian. So I grew up multiculturalism was just so natural to me, And in Hawaii, everybody identifies themselves as like multiple genetics, right? And multiple ethnicities. So for me, I think it's a really beautiful part of the work to respect that.
I think in my next life, I'm coming back as Hawaiian French. That just sounds amazing. Michaella, you work on an energy level as well as a physical level. How does facial massage help with the whole kind of you touched on it earlier, the psychological aspect of aging and the relaxation benefits of facial massage? I presume they're interlinked, aren't they?
In so many ways, to be honest, in ways of how someone comes in and their energy is through the roof because they've just hit traffic on the way in, or they couldn't park the car and they had to run in the rain, and it just completely offsets you. And then just coming in the door, I always just say, take your coat off, take your shoes off and your bag down. Let's just take a moment and breathe. Okay, now we're in the room, now we can start. So I'm always trying to, I'm quite an energy person as well. So if I meet someone that's a very different energy to me, I always try and touch that energy base. So if they're quite high energy, I'll try and meet them at that energy. But I do believe that a lot of us are working on an energy level that is too high. We get so caught up in the hustle of life and social media and looking our best equals feeling our best, but it really doesn't. It's actually just being self-secure and just having a little bit of love for yourself and being able to look in the mirror and smile and not be unhappy or pick at yourself that morning. So I think that I like to work with no shoes on as well. So when the client comes in, it's all about grounding and just bringing everything back down and just taking a moment, because we are human.
I'm feeling better already.
We all work on it's a nervous system, isn't it? It's our somatic system. We have to just bring everything down to be realistic and see clearly and feel clearly. So it is all about energy and just making sure that we're on the same energy before I can start, because trying to do a facial massage on someone that's clenching their jaw is impossible. Trying to do facial massage on someone that is holding themselves so tightly on the bed is impossible, because I'm never going to get to work through the muscle. I work in muscle tissue, so I need them to be calm and relaxed to be able to get through that benefit, breaking down the tension, working on the lymphatic system. So everything I do has to be on a low energy level to bring them down. That's why everyone floats away.
Thank you. My final question to everyone, I want to give everybody something practical to take away. If you are in your 50s, I'm going to make it selfish practical, and thinking about your face, whether that's surgery, non-surgical treatments or massage, starting with you, Marc, what should you do first?
Skincare, personally, as a surgeon, I think is the number one thing to start with. If I look at my facelift patients who've come back 5-10 years later, they haven't aged often because of the facelift having dropped. It's because they haven't looked after their skin. So I think start with skin.
That's so interesting. I mean, I know that, but it's interesting to hear a surgeon say that as well. Thank you. Jonquille, what would you say?
I'd agree with Marc. I suppose mine is, remember, we're in an unregulated market, and there's many practitioners and products that can look very glossy and very appealing. But I would recommend to follow those and choose those who have invested in evidence and in their patients and have tried to contribute to research and to proof and really invested in their patients rather than putting all that time and money into glossy marketing.
And Michaella, what about you?
Facial massage, of course, because that just fits into everyday routine. 5 minutes in the morning, 5 minutes at nighttime can make such a big difference. And it's about blood flow, blood circulation, oxygen, nutrients, everything's flowing a bit more freely, working on your lymphatic system, waking everything up. So facial massage, definitely, but skincare, of course, but personalised skincare. So if you're confused about your skincare routines, your skincare products, what ingredients should I be using at this age, or what ingredients should I not be using compared to what somebody else is using, so it's not a trend. So personalising your skincare routine so it works for you, and then make your skincare work harder for you with facial massage, some gua sha, doing some microneedling on the surface just to try and get extra product into the skin, rejuvenation, cellular rejuvenation. Just working on the glow will make you feel incredibly confident and just a little bit more empowered in your routine.
Thank you. I'd like to finish by thinking that by reflecting on something you said, Marc, in our phone conversations, which is that one of your patients once said to you, "You're looking terrified." What did they say? One of your patients said, "Nobody knows what it's like to be in someone else's skin." And I think that's so true. Really, the whole point that we should be at now is to never judge other people's choices, but to always support them from a place of knowledge and self-compassion and realistic expectations. And I think that's what we've got from listening to all of you today. So thank you so much. I'd like to... My takeaways are going to be from Marc. I think that you should look like you and no one should think you've had anything done. From Jonquille, your commitment to proper education and mental health. And Michaella, I loved your emphasis on taking time and working with your body and finding that balance. So I'd like to give everybody a round of applause and thank you so much for your generosity and your answers and taking time today.